My name is Alex Schultz. I'm a physician assistant with ROSM, Regenerative Orthopedics and Sports Medicine. So the knee joint is one of the most important joints in the body. It's the largest and one of the most complex. Because it's so complex, it can be a hard time finding more precise diagnoses and treatments for it. One of the devices we have at ROSM is called the knee kinesiography. This is similar to how an electrocardiogram is to a heart. This is to a knee. That's why it's called a KneeKG. Very fun pun. So basically what this machine does, it helps give a quantitative analysis of the different movements of your knee. So the kinematic movements, things such as flexion, which is bending of your knee, or extension, which is straightening out of your knee. We can find different degrees of deficiencies that you might have in that. And based off those deficiencies, you can find different exercises or treatments, whether it may be something more conservative like physical therapy or even something interventional like injections. The way that we do this is we get on a treadmill and put an apparatus on your knee, around your hips, and also around your lower leg. The knee is the center point, and this machine assessment does not just give us information for the knee, but also for the hip and the ankle. Before we put the apparatus on, we'll usually get the patient to do a warm-up walk on the treadmill for about 5 to 10 minutes, and then afterwards we'll set up the apparatus and do some calibrations when the patient is stationed, when the patient is just standing still, but also we'll run them through a few different movements to make sure that the camera is catching the motion detection properly. So after that is captured, then the actual testing is only 2 45-minute walking trials, just as long as everything is staying on correctly and not falling off. The thing that's really cool is that you can also do an assessment of wearing orthotics or even sacroiliac belt, something afterwards to see if that changes the kinematics of your knee as well. What we usually do though is test it several months later after treatment, whether it be a course of physical therapy or doing some type of interventional treatment to see how that has changed things, and we can get a pretty accurate quantitative analysis on how it has changed things and how things may be benefiting. We'd also couple this with subjective information that we can get through our physical examination as far as improvement in pain, or objective information that we can get through our physical examination. Anybody can take this test as long as you can walk on a treadmill and you can walk in your bare feet. This can also test it with shoes just to see how that changes things. This is good for anybody who is preparing for, but not just athletes, but anybody who is experiencing any type of knee, hip, ankle, or foot pain, any type of lower extremity problem. It can give us an idea how to better approach this and deal with the problem.